Reimagining Rural Health, a podcast series brought to you by Sanford Health. In this series, we explore the challenges facing healthcare systems across the country, from improving access to equitable care, building a sustainable workforce, and discovering innovative ways to deliver high-quality, low-cost services in rural and underserved populations. Each episode examines how Sanford Health and other health systems are advancing care for the unique communities they serve. In this episode, Matt Holson with Sanford Health News talks with Tammy Leto, Administrator, and Allison Tator, Administrator, Home Health at Good Samaritan Society, Loveland, Colorado, on the topic of retaining the senior caregiving workforce.
I'm chatting with two administrators from the Good Samaritan Society in Loveland, Colorado. Tammy Leto leads a very large campus with a variety of services, and Allison Tator directs the home health team. Thanks for being here.
Well, thank you for having us.
Thank you.
We're talking about retaining caregivers, the senior caregiving workforce. What are some of the biggest challenges you face when doing that, Tammy?
Well, I think we're still seeing a little bit of the after effects of the COVID pandemic with some occupational burnout and, just trying to work with our staff, just engaging a little bit more and trying to recognize that stressor in their life. We also have, competitive wages with other competitors in the area. There's a strong desire for more enhanced work-life balance with our staff and, just patient safety overall of our residents and the overall workload, I think are probably some of the biggest factors that we are kind of still seeing.
And for people who don't know, Loveland is a big how many employees do you have?
Gosh. Well, we are a continuing care campus, so we have independent living, assisted living, and then our skilled nursing, which we call healthcare. And I'm the administrator for the healthcare side of Loveland Village. We probably have anywhere from maybe close to 275 employees overall on our campus.
Allison, what are some of the challenges your team faces?
I think for me, just having all of my staff at different campuses, not only at Loveland, but also in the community, is the communication. I think that's a huge barrier of just making sure that everybody's informed and feels like empowered and recognized. And it's obviously something that you have to have a heart for. And a lot of the staff that I do retain have been with me 12 years, 5 years plus. I think that's the hardest part, is finding that staff member that can do it and encouraging them and, knowing that it's hard taking care of somebody. And sometimes they can be grumpy and don't take it personal, but also support them.
What are some of the other roles that fill out your team?
So there's the caregiver, I have business office coordinators in the office, then I have nursing and therapy.
So what strategies are you using to try to address this issue that are proven to be successful, do you think?
For me, it's like I always have an open door. They also, if my door is closed, they know they can text me. If I'm in a meeting, I think that they all know that. And that's kind of when I came over to Services at Homeside in 2016. That's kind of been mine, where I try to send cards. I try to send texts. I recognize them. I do when they start orientation, I ask what their favorite soda is, or just little things, because I think that goes a long way when you just notice them for those little things. Birthdays, anniversaries, kids' birthdays, husbands' birthdays.
Yeah, the little things mean everything to many people. Tammy, what's working for your team?
When we do have a new hire, we do what's called bubble wrapping the employee, and we highly try to protect them in that first 90 days of employment. We have a scoreboard posted at our facility, and we do have scoreboard rallies to celebrate when they reach their 30 days, 60 days, and 90 days. There's dancing, there's music. It's just a great time overall. But part of that is also our current employees and trying to invest with them at the same time. So we connect them, our new employees, with mentors. And so we celebrate those mentors with mentor bonus checks, like big checks, like you're on The Price is Right, at our scoreboards. We also do employee referral bonuses. We started a new program called Pickup Points about a year ago as well. So when staff do pick up shifts, they earn points and they can cash them in on a catalog that we have. And so we award those at our scoreboard rallies when somebody does cash in for pickup points. And so that's allowed us to now be totally agency free for over a year now. So, that in and of itself is a great celebration. So, and then one of the things we, as Allison was alluding to, finding that perfect caregiver, whether it's a CNA or nurse. And so, like, especially with my director of nursing, it's becoming our interviews are more intentional, more behavioral based questions, engaging other staff as part of the interview process, or taking that prospective new employee on a tour. So you're just trying to find the right fit for success for the new employee and then also for the organization.
That's incredible. So you're obviously not sitting back, and you're being active in this and trying to recruit and retain. How do you gather and act on feedback from your caregiving staff?
Sure. Well, we do huddles, throughout the day. So they're like, some of them might be like intentional touch points and just rounding, seeing how the staff are doing that day, what their challenges are. Is there anything we can do as far as assisting with supplies or answering questions? So those are, throughout the day. And then we also obviously just completed our Peakon engagement survey. So we'll be reviewing, finishing up review of all of our comments, putting our action plan together. And just for example, I have a meeting scheduled with my staff next week, just to kind of share the results from our side of the building and just try to engage them in, okay, what are some things we can work on? Like, what are your specific challenges? Because if you're trying to put an action plan together, you really need to involve your staff in that. Otherwise, your action plan could go in a totally different direction that isn't going to address what their concerns are.
Allison, what would you add to that?
Well, I would say that it's a complete blessing to be at Loveland's campus. And I think for my staff there, they feel that. And it's a family. It's a happy environment. I know when there's tours, when there's anything that's going, or when I'm, taking a new hire around, they're like, is it really this happy? It is. It's not me. I mean, the residents are happy. The staff is happy. They're there. And so, yeah, I would just probably say along that, it's knowing your staff, just really being there for them and having them know that they're a part of it and that you're trying to communicate all of the changes that happen with our company, let alone at a location level. So they feel like they're not being blindsided, that they know what's going on.
How do you see your roles evolving to better support caregiver retention, Allison?
I would say to continue to be positive. I know I have a board in my office that says I get to. Instead of I have to, I get to go to work. I get to make a difference. I also have it at home. But I think that is something to make sure that I stay positive, even when there's days you close your door for a minute and you're taking a deep breath yourself. But I think that positivity and then just reassuring people that it's the right fit, that it's a great place and all the other benefits our company has.
And for myself, I've been in this industry for over 30 plus years now, and it's always been highly recognized that for the resident and their quality of life, the biggest factor for that is the CNA that is assigned to them. So you can't utilize techniques that you might have used like when I first started. You have to evolve with all the changes that are happening yourself. In our workforce now, they want to be engaged and they want to be involved in the decision making. So I feel like the more transparent you can be with everything, the better. And as Alan said, we're a fun campus and we enjoy having fun, and you should have fun at work. And, so we go dancing down the halls, there's just all kinds of fun themed events that happen on our campus. And so the more that you can do all that, I think, is for success in the long run.
I've been there a few times. It really is a fun community like you described. I want to thank you both for joining me here in this discussion about this important topic, retaining the senior caregiving workforce. Have a great day.
Thank you.
You too.
You've been listening to Reimagining Rural Health, a podcast series brought to you by Sanford Health. Hear more episodes in this series or other Sanford Health series on Apple, Spotify, and news.sanfordhealth.org.